Welcome everyone, I'm Dr. Lars Thestrup, Medical Director of the Houston Marathon, and I'm standing here with...
Hi, I'm Dr. Matt Sedgley. I'm the Sports Medicine Director for the Baltimore Running Festival, here volunteering this year.
And today we want to go over Tarp Associated Cooling with Oscillation, also called TACO. What this does is it treats exercise-induced hyperthermia. The definition of exercise-induced hyperthermia is ultramental status with a core body temp of 104.
You have to confirm that when someone comes in and they are confused. Make sure they have a pulse, make sure they're breathing. If that is the case, but they're confused, you want to get a core temperature. The way we do that is we usually don't use temperatures on the scalp or the ear or the mouth. We're trying to get a rectal temperature, usually as a core temperature on the course, and we have special thermometers for that.
With that core temperature, obviously we'd like to get a full set of vitals. You want to get a blood pressure, heart rate, but really that core temperature is what drives our next steps in the process. Once you've confirmed that the core temperature is greater than 104 degrees Fahrenheit, we utilize the Datatherm to continuously monitor the core body temperature. Here you have the Datatherm 2, and then you have the probe, which plugs into the side of it, and then you have the distal end of the probe, and this probe gets inserted into the rectum approximately 6 inches. Make sure you lube before insertion.
Easy turn on, turn off. Beginning of the day, always make sure the battery is working before you need it. We're going to demonstrate here how to get a core temperature. We often will have the runner come in confused. We'll bring them into the first aid station area. We then want to give them privacy with a blanket. And then we have the core temperature being checked with a rectal thermometer going in 13 centimeters or about 6 inches. This is placed and then often taped to the leg and left in place so we can get a continuous read of the core temperature while the patient's suffering from heat stroke. This allows us to monitor the temperature as we're treating him with the TACO method.
A couple pearls when you're about to perform this procedure. First, you may want to remove excess clothing. You want to leave on sports bras. You should be taking off probably socks and shoes or any other excess clothing besides the shorts. We also suggest checking for electronic items in their pockets and remove them as well. And also when you're performing the procedure, make sure you're explaining to the patient what are you doing before you do it.
Once we have the patient identified as having heat stroke, we want to start to treat that. We'll move the patient into the cooling bag and we want to support the head at all times. We don't want the patient who may be confused to get water in and possibly choke. At the same time, we're going to put 2 bags of ice into the cooling pod with some water, which will then be oscillated back and forth to start the cooling process. And you're going to have one person controlling the rectal thermometer at all times, following those temperatures every 1 minute.
As you can tell, to perform this correctly is going to require a minimum of 5 people. We actually would suggest 6 if we have 2 on either side, 1 person dedicated to the head, and then you have your recorder. Once your patient's core temperature has reached 102, it is advised to continue monitoring your patient. A lot of patients with exercise-induced hyperthermia can have a rebound hyperthermic episode of which they would need to be treated again.
It's important to realize you may correct the patient's core temperature from being too high, but if they continue to be confused, it's important to look for other reasons. This could be that their glucose or sugar is too high or too low. They might have other causes like low sodium. This comes from drinking a lot of water while running long distances. So once their temperature is corrected, if they're not thinking straight or they still have neurologic problems, make sure you pursue those and communicate that well with your leadership.
Lastly, we want to thank all our volunteers. Thank you.